Have you ever wondered how your body stops itself from bleeding out after a cut? This is where the amazing process of coagulation comes into play. It's a complex dance of proteins and cells working together to form a clot and halt bleeding. It's a vital part of our body's defense system, ensuring we don't lose too much blood from a simple injury. But what happens when this system doesn't work as it should? In this video, we delve into the fascinating world of coagulation disorders. Coagulation disorders, in essence, are problems with blood clotting. To better understand this, let's break down the process of coagulation, or blood clotting in layman's terms. Imagine a bustling city, with people constantly moving around. Now imagine an accident happening in that city, and the immediate response that follows. That's somewhat similar to how our body reacts when there's an injury. Blood vessels are like the city's roads, constantly flowing with traffic. Our blood. When there's an injury, it's like an accident on these roads. The body's immediate response is to stop the bleeding, just like how emergency services rush to an accident scene. This is where platelets, tiny blood cells, come into the picture. They're like the first responders, rushing to the injury site and sticking to the damaged area, forming a plug to stop the bleeding. This is the initial phase of coagulation, but it doesn't stop there. The body then launches a complex process involving a series of proteins in your blood, called clotting factors. They work in a domino effect. One activates the next, which activates the next, and so on, creating a substance called fibrin. Picture fibrin as a sturdy net, reinforcing the platelet plug and ensuring the wound is sealed off. Now, coagulation disorders happen when there's a problem in this intricate process. Maybe the body isn't producing enough platelets, or perhaps the clotting factors aren't functioning as they should. It's like having fewer first responders or a breakdown in communication between them. This can lead to excessive bleeding or clotting, which can be harmful, even life-threatening. Understanding coagulation disorders is crucial, not just for those affected, but for all of us. It provides insights into how our body works, the importance of each component, and how a disruption in any part can lead to serious consequences. Now that we understand the basics, let's move on to the different types of coagulation disorders. Coagulation disorders come in many shapes and sizes. They are a diverse group of conditions, but they can be broadly classified into two main categories: excessive clotting, also known as thrombosis, and insufficient clotting, often leading to hemorrhage. Let's start with excessive clotting or thrombosis. This occurs when blood clots form too easily or don't dissolve properly. These clots can block blood vessels, obstructing the flow of blood to vital organs. This can lead to serious conditions like strokes, heart attacks, and deep vein thrombosis. Now, deep vein thrombosis, or DVT as it's commonly known, is a condition where a clot forms in the deeper veins of your body, usually in your legs. It can cause pain and swelling, but sometimes it may occur without any symptoms. Now, moving on to the second category, insufficient clotting. This is the opposite of thrombosis. Here, the blood doesn't clot as it should, leading to excessive bleeding. This might occur spontaneously or in response to an injury or surgery. Hemophilia is a classic example of this type of disorder. It's a condition that impairs the body's ability to make blood clots, leading to excessive bleeding. Hemophilia is usually inherited, meaning it's passed down from parents to their children through their genes. Another example is von Willebrand disease, which affects the clotting process due to a deficiency of von Willebrand factor, a protein needed for blood clotting. People with this condition may experience prolonged bleeding or excessive bleeding following an injury or surgery. Other disorders that can lead to insufficient clotting include disseminated intravascular coagulation, also known as DIC, where the proteins that control blood clotting become overactive. This can result in small blood clots that block blood vessels and cut off the normal blood supply to organs. It's important to note that some coagulation disorders can result in both excessive clotting and insufficient clotting. For example, in certain stages of DIC, you may initially have excessive clotting followed by a stage where the blood can't clot properly, leading to serious bleeding. These disorders can range from mild to severe, and their effects can greatly impact a person's quality of life. Symptoms can vary greatly from person to person, and treatment options will depend on the specific disorder and its severity. To summarize, coagulation disorders can be broadly classified into two categories: excessive clotting and insufficient clotting. Examples of disorders that cause excessive clotting include conditions like deep vein thrombosis, while disorders like hemophilia and von Willebrand disease can lead to insufficient clotting. Some conditions like DIC can cause both excessive and insufficient clotting. Next, we'll look at the causes of these disorders. What causes coagulation disorders? Now that's a question with more than one answer. Coagulation disorders can be caused by a variety of factors, and we'll dive into each one. First up, genetics. Many coagulation disorders are inherited, meaning they're passed down from parents to their children through genes. Hemophilia, for instance, is a well-known inherited coagulation disorder. If you have a family history of coagulation disorders, you may be at a higher risk. Next, let's talk about lifestyle choices. Yes, the things you do every day can influence your coagulation process. For example, a diet low in vitamin K can affect your body's ability to form clots. Vitamin K is crucial in the clotting process, and it's found in foods like green leafy vegetables and certain vegetable oils. Smoking and excessive alcohol consumption can also negatively impact your coagulation system. Certain medical conditions can also lead to coagulation disorders. Liver disease is a big one because the liver produces most of the proteins involved in clotting. So if your liver isn't functioning properly, your coagulation process might be affected. Similarly, conditions like kidney disease and certain types of cancer can also cause coagulation disorders. Medications, too, can play a role. Some drugs, such as anticoagulants or blood thinners, are designed to prevent or slow down clotting. They're often prescribed to people at risk of developing dangerous clots. But if not managed properly, these medications can lead to coagulation disorders. And finally, age can be a factor. As we get older, our bodies undergo many changes, and our coagulation system is no exception. The risk of developing coagulation disorders tends to increase with age, particularly if combined with other risk factors. In summary, the causes of coagulation disorders are multifaceted, ranging from genetic factors and lifestyle choices to certain medical conditions and medications. And let's not forget about age. Understanding these causes is a crucial step in managing and preventing these disorders. Now let's turn our attention to how these disorders are diagnosed. Diagnosing coagulation disorders involves a series of tests. It's not as simple as a one-and-done process, but rather a step-by-step exploration, unraveling the mystery of what is causing the abnormal blood clotting. The journey of diagnosis often begins with blood tests. These are crucial to evaluate the clotting factors in your blood, the proteins that work together to stop bleeding when a blood vessel is injured. These tests can include a complete blood count, prothrombin time, activated partial thromboplastin time, and others. Each offers a unique lens into the body's coagulation process, shedding light on possible irregularities. However, blood tests alone may not always provide a complete picture. That's where genetic testing can play a pivotal role. Genetic testing can help identify any inherited disorders, such as hemophilia or von Willebrand disease, by analyzing the DNA for mutations that may be causing the issue. This is particularly useful in cases where there's a family history of coagulation disorders. Yet, even with the insights provided by blood and genetic tests, the diagnostic process doesn't stop there. Sometimes, imaging studies are necessary to visualize the blood vessels and identify any abnormalities such as clots or bleeds that may be causing symptoms. This could involve an ultrasound, computed tomography scan, or magnetic resonance imaging. Now, you might be wondering, why all these tests? Well, the truth is, coagulation disorders can be complex. They can be caused by various factors and can manifest in numerous ways. Therefore, a comprehensive approach to diagnosis is necessary to ensure no stone is left unturned. And there's one more thing to keep in mind. The importance of early detection cannot be overstated. The sooner a coagulation disorder is diagnosed, the sooner the appropriate treatment can begin. This can help prevent complications and improve the quality of life for those affected by these disorders. Finally, we'll discuss the treatment options for these disorders. Because, after all, diagnosis is just the first step towards managing and overcoming a coagulation disorder. Treatment options for coagulation disorders depend on the type and severity of the disorder. So, let's delve into the variety of treatments available, shall we? For starters, medication plays a significant role. Anticoagulants, also known as blood thinners, are often prescribed to prevent clots from forming. These include drugs like warfarin or heparin. For those with clotting factor deficiencies, replacement therapy can be a lifesaver. This therapy involves infusing the missing clotting factor into the bloodstream. Then there's the category of antiplatelet drugs. These help to prevent platelets, the tiny blood cells that stick together to form clots, from clumping together. Aspirin is a common example of an antiplatelet medication. In some cases, thrombolytic therapy may be used. This involves using drugs to break up existing blood clots, effectively restoring normal blood flow. But not all treatments are pharmaceutical. Lifestyle changes often play a pivotal role in managing coagulation disorders. Regular exercise, a balanced diet, and smoking cessation are some of the key steps one can take to improve their health. A low-sodium diet, for instance, can help to reduce blood pressure, thus reducing the risk of blood clots. In more severe cases, surgical interventions may be necessary. This could include procedures to remove or bypass a clot, or to repair a damaged blood vessel. For some, a mechanical device like a compression device or a vena cava filter might be implanted to prevent clots from reaching the heart or lungs. Now, it's important to remember that all these treatments come with their own potential risks and side effects. That's why the role of medical professionals in managing these disorders is absolutely crucial. They will be able to assess the individual's health status, consider their specific disorder and its severity, and then recommend the most appropriate course of treatment. They will also monitor the individual's ongoing health and adjust the treatment plan as necessary. Regular checkups are key to ensuring that the treatment is working effectively and that any potential side effects are managed promptly. Moreover, healthcare professionals can provide education and support. They can help individuals understand their condition, manage their symptoms, and adhere to their treatment plan. They can also connect individuals with support groups and other resources, helping them to feel less isolated and more empowered in managing their health. So, while coagulation disorders might sound intimidating, there's a wide array of treatment options available. From medication to lifestyle changes to surgical interventions, each treatment is tailored to the individual's needs and circumstances. Remember, medical professionals are there to guide and support those living with these disorders. They're not alone in their journey towards better health. With the right treatment and care, people with coagulation disorders can lead healthy, normal lives. So, let's continue to spread awareness, encourage early diagnosis, and promote effective treatment for these conditions. So, we've learned quite a bit about coagulation disorders today. And in doing so, we've unraveled the intricate tapestry of our body's ability to clot blood and what happens when this process goes awry. We started our journey by understanding the basics of coagulation. We walked through the complex dance of clotting factors, platelets, and blood vessels that work in harmony to prevent excessive bleeding. We learned how this delicate balance can be disrupted, leading to coagulation disorders. We then delved into the different types of coagulation disorders. From the inherited disorders like hemophilia and von Willebrand's disease to the acquired ones such as vitamin K deficiency and liver disease, we saw how each disorder has unique characteristics and impacts on the body. We also explored the causes behind these disorders. We realized that while genetics play a significant role in many coagulation disorders, environmental factors and underlying health conditions cannot be ignored. We recognize that something as common as a poor diet can lead to vitamin K deficiency, disrupting the clotting process. And we saw how liver diseases could impact the production of clotting factors, leading to coagulation issues. Diagnosis of coagulation disorders was our next port of call. We understood how a combination of medical history, physical examination, and various laboratory tests help clinicians pinpoint the exact disorder. We learned about the role of tests, like the prothrombin time and activated partial thromboplastin time, in assessing the clotting process. Finally, we looked at the range of treatment options available. We saw how the focus is not just on managing symptoms, but also on preventing complications. We learned about the use of clotting factor concentrates in treating inherited disorders and the role of vitamin K supplements in tackling acquired disorders. We also discovered the importance of lifestyle changes and regular monitoring in managing these disorders. So, our journey through the world of coagulation disorders has been quite enlightening, hasn't it? We've not only learned about the science behind these disorders, but also grasped their impact on our lives. And as we navigate our way through the world, this understanding can guide us in taking care of our health and supporting those around us who are affected by these disorders. Remember, knowledge is power. Understanding coagulation disorders can help us better manage our health and support those who are affected. Thanks for watching.